takes a minute sometimes. Okay, now we are ready.
Excuse me. Good evening, everyone, and Happy New Year to all. Welcome to the January 9, 2025 meeting of the Health and Environmental Committee. My name is LV Barroso, and I'm the chair of the committee. Tonight, we are joined by Assistant District Manager Brendan Burt, and this meeting is called to order at 6:33 p.m. As a reminder, New York State law requires all committee members who are not able to attend the meeting in person to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. Members of the public who are attending virtually, you can raise any questions or comments that you have through the Q&A feature of Zoom. Members of the public who are here in person, you can raise any questions that you have by raising your hand. If there is time following the committee's discussion, we will field questions from the public. Marty is taking minutes tonight. Thank you so much, Marty. And we will now take attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name. When your name is called, please say present. I will announce if there is quorum. Marty Barrett.
Present.
LV Barroso.
Present.
Rob Friedman won't be with us tonight. Rupal Kakad.
Present.
Sandra Leftoff won't be with us tonight. Kevin O'Keefe.
Present.
Okay. Marion Rowe.
Present.
And Mubin Siddiqui also won't be with us tonight. We do not have a quorum.
The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, please raise your hand. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the November 14th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, please raise your hand. Seeing no objections, the minutes from the November 14th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members who are here in person, if you have a question about the committee business or wish to make a motion, please raise your hand and I will identify you so you can speak. Committee members unable to attend in person, if you have a question about committee business, you may raise your hand through Zoom and I will identify you so you can speak. All committee members, it is extremely important that only one person speak at a time so that members of the public watching at home can understand what is being said by each committee member. The chat function for committee members present via Zoom should not be used for committee business or questions about agenda topics. All such remarks should be made on a record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. Tonight's agenda. The first one is a presentation from the New York League of Conservation Voters on lead pipes in New York City. Our speaker tonight is Joshua Kleinberg, who is a senior vice president. Joshua has led the candidate evaluation and endorsement process for NYLCB. Over the years, he has played a key role in many federal, state, and local campaigns, including nonpartisan engagement, candidate forums, bond acts, ballot initiatives, issue campaigns, lobbying efforts, and independent expenditure campaigns. Over the past few years, a primary policy focus of his has been on chemical policy reform in New York State, specifically efforts to eliminate toxic chemicals from children's products, reduce lead in public school drinking water, and remove lead service lines. He also works closely with all NYLCB department heads, providing guidance and assistance in the planning, implementation, and analysis of projects. Joshua has a passion for service learning, which was inculcated in him during stints in the American Legion's Boy State program, as well as the inaugural class of President Clinton's AmeriCorps. Joshua is a graduate of Manassas Public Schools. He earned a BA in Urban Environmental Studies from the Brandeis University and a master's in urban planning from the Robert F. Wagner School of Public Health at New York University. So please welcome Joshua Kleinberg.
Great. Thank you very much for that introduction, and thank you all very much for the opportunity to address you this evening. Might I ask, how long of time have you budgeted for the presentation? Because I do want to make sure I have ample opportunity to answer questions as well.
About 30 minutes.
As you wish. I will keep my presentation to that schedule so that there's plenty of time for questions. I'm delighted to be back here at Community Board 6. And what I mean by that is, if anyone was on Community Board 6 25 years ago, when I was a graduate student at NYU Wagner, as was mentioned, Community Board 6 was our client for my graduate school capstone project, where we did a report on, believe it or not, the Con Ed Waterside site, which I'm sure is a constant topic of conversation with you all. But I'm really delighted to be back here. But I'm here to talk about lead pipes. And as was mentioned before, I've been working on this as a statewide level. But just a few months ago, about a few weeks after the federal EPA announced its lead and copper rule improvements in October, and that's the new rule that will require, among other things, all lead pipes to be removed over a 10-year period starting in 2027 through 2037. My organization released a report on the state of lead pipes here in New York City. New York City has been putting out data for years. I've been monitoring, I've been tracking it, I've been visualizing it, and I was waiting for this moment for the lead and copper rule improvement to come out so I could release that report. And I wanted to share with you the results of the report. And then I do have a special set of slides for Community Board 6 to let you know the situation happening there. So let me share my screen with you and take it from here. And I'll put it on very large so you can see the entire screen here. Okay, hopefully folks can see that well enough. About the organization, I work for the New York League of Conservation Voters and the New York League of Conservation Voters Education Fund. We are a nonpartisan environmental organization. Through our work, we're hoping to educate, engage, and empower citizens and elected officials and people in business, anyone who cares about the environment, wherever they're at, so that they can become better stewards and better advocates for the environment. And of course, the work that you all do at Community Board 6 and in particular this committee, I have great regard and great respect and great appreciation for that. So it's another reason why I'm really happy to be here to talk to environmental advocates at the grassroots like you all are. The topic of lead poisoning, as folks probably have known about this, lead is a very dangerous toxic chemical. It impacts the way that people think and how they act. It affects behavior and leads to all sorts of learning disabilities, cognitive issues, as well as issues related to brain development, heart development. This is really it's as I said originally, it's no joke, and to know about lead exposure at any source, it's important to recognize so you can limit and prevent lead poisoning. Unfortunately, lead is ubiquitous, despite us knowing about its hazards for literally millennia. It's still present and ubiquitous within our society because of a lot of activities that happened, quite frankly, during the Industrial Revolution, where there was little regard or not enough regard for public health in this respect. And even though lead in our country was effectively phased out and eliminated, starting in the 60s, 70s, 80s, it's still there in terms of being present in soil and in water. You'll find it in as you see from this slide, is in some pottery and jewelry and spices, etc. So there's a lot of different sources, and there's a widespread effort to try to eliminate lead and to eliminate that lead exposure. I wanted to talk to you today about our drinking water, and I always have to start off with this beautiful slide to remind folks that we have really some of the best drinking water in the world, the largest unfiltered source in the country, and it's magnificent. And lead is rarely, if ever, found at drinking water sources. It's rarely, if ever, found when it travels from the aqueducts through the piping system, the water mains, and the pollution prevention, pollution control plants. That's not really where the problem is. It's really when it gets to the delivery of the water to a particular property. So when you're talking about water delivery to a particular property, from the main, it leaves to the property by way of a service line. And that's the first place where there could be trouble in terms of lead exposure. If that pipe or a connector of that service line is made of lead, that's where the trouble can start. And I'll talk about that a little bit more. The other aspect of where lead could be found is not the topic of tonight, although it is a concern. It has to do with more of the indoor plumbing, and that would be faucets and solder and things like that. But for the purposes of tonight, we're going to be really focusing on the service line, that straw, if you will, that connects from the water main to the building. And so it's important to understand the chemistry, and because this is really a chemistry situation more than anything, because there have to be a few different conditions for lead to get into or to leach into drinking water. And that's important to know because there is a little bit of a random nature of lead exposure in water. What I mean by that is if you had a lead paint and lead paint was on your wall and you were to take a sample, 100% of the time, you'll find that there's lead within that paint. But when you draw a sample of water, you won't always get an elevated level of lead. And the reason for that is twofold. Number one, and this has to do with the chemistry, if you have water in a pipe that's sitting for a long period of time in that service line, as I mentioned, that's sort of in the street or within your apartment building, and it's sitting for a long period of time, let's say for 8 hours or so or more, and the pH, and you have a corroding pipe, and the pH level of that water is perhaps not what it should be, and the corrosion control, which is the protective food grade additive that the city puts in, isn't as good as it could be. There could be conditions by which lead could perhaps leach into the water, so that when that first draw is taken first thing in the morning or after a long stretch of the day, if you're not in your home all day long, when the water's been sitting, that first draw could contain elevated levels of lead. And so that's one way That's one way lead gets into water. The other has to do with physical disturbance, and this is not unique to New York City. There's a lot of construction, there's a lot of trucks, there's a lot of things rumbling around in the streets, so that when the water is sitting in that pipe, that same pipe for a very long period of time, and there's any kind of shaking, that's again another instance where lead could get in there. So I always want to let people know about the chemistry of how lead gets into water, because it's important to know, and it helps to prevent exposure. And I'll get into that in just a moment. When we're talking about the service lines in New York City, we're really talking about, and this is true across the board, but we're really talking about smaller and older homes. Okay, so smaller homes would be, think about a single family home, or think about a walk-up apartment building. So I guess the rule of thumb is, if there's an elevator in the building, that's not necessarily a small home. So 4 to 8 family homes, walk-ups, those sorts of things. And the older would be pre-1961, because pre-1961, 1961 is when lead pipes were banned in construction in the city of New York. Prior to that time, I can tell you, though, from 1961 back until the 1850s, when water started coming from the aqueduct that I showed you that picture earlier, it was the policy of the city of New York to permit lead pipes. At times, they encouraged lead pipes, and there was even a 25-year period where they even required lead pipes. But that's another discussion for another day. That's in the report that I'll share with you later. The reason why I mentioned the chemistry earlier was just to let you know that there's news you can use immediately in terms of lead poisoning prevention with water. Flush your water every time that there's long periods of stagnation. So first thing in the morning, or if you're out all day, it's been sitting out for more than 8 hours or so, just run that water for a minute or two till it gets nice and cold. You have you should have an aerator filter at your sink. You should clean that out monthly. It's always a good thing. You'll always find some stuff in there. You can get a free testing kit from DEP, going online or calling 311. Never cook with hot water. So I always want to let people know up front, before I get into the statistics and all that, this is preventable, and with some simple steps. However, the most assured way to prevent lead poisoning in the first place is to remove the pipe, and we'll get into that later on in the discussion. So as I mentioned, we put out a report. My organization put out a report. I want to say it was like early November, mid-November, and we went into the data aspect of things, and there was some mapping that went along with it. First, let me just tell you about the data aspect. I'd like to take things at a high level as possible, and then as we continue the conversation, zoom into the micro level, because it's always good to understand the context here. So when we're looking at the citywide perspective, there are approximately 857,000 properties that have water delivered to it through a service line. Okay, and of that 857,000, about 14% of them, or 124,197, are confirmed to be lead. Confirmed meaning that the Department of Environmental Protection, they have records. It's either excavation, observation, or historical, that particular line is made of lead. There's another 15% or another 124,000 that's unknown, or possible lead. And so the city doesn't have records, so they don't know what it is. But from a public health perspective, you have to assume that it's possibly lead until proven otherwise. And then the balance of the other information there, it's not lead or not applicable. So you have about roughly 30% of the drinking water lines in the city of New York, with that breakdown that I just mentioned before, being lead or possible lead. And that roughly equates to about 1.1 million people, or basically 1 in 6 New Yorkers, more or less. So about 20% of the population. So it's something just to be aware of. I'm sorry, less than 20%. It's about 16% of the population. It's something to be aware of. There are other parts of the city, the country, that have a far greater proportion of lead pipes. Cleveland has many, Chicago has many, Buffalo has many. we in New York don't have as many proportionally, but we have over 100,000, so it's considered to be a pretty big deal. Just to kind of quickly go through the data of the known lead pipes, and this data from now on, I'm really going to focus on what we know, and this is the 124,000 to 14% that we know about. This is the distribution of where the pipes are. So mostly in Queens and the Bronx, they're above the citywide average, and then below average Brooklyn, Manhattan, and Staten Island. And so that's where you're finding most of the known lead pipes. We've been able to take this data and really bring it down in so many different ways by neighborhood using the United Hospital Fund district lines, kind of give you an idea of where things are at in terms of concentration. So again, if the citywide average is 14%, you have neighborhoods in Queens and the Bronx, like Jamaica and Pelham, where it's actually 25%, which is much higher than the borough average. So it's important to always know about the citywide information and the citywide percentages, but really when you get down to the micro level, sometimes you'll see rates that are much higher. And so this report, and I'll share this in the chat, and I can email you, by the way, these slides and the report and all this after this meeting. The report goes into other details as well, which I'll go through quickly because I think you all are probably most interested in seeing about what's happening in CB6. But we analyze the data in terms of where the pipes are in disadvantaged communities versus non-disadvantaged communities. Oops, sorry. And where that is distributed by borough. We looked at information in terms of the political jurisdictions, which comes in very handy when we're speaking to our local elected officials, that we're able to tell them what the situation is in their district. And so we have it by congressional district and Senate and Assembly, council district. Again, I'll send you this report. It's all in there for you to see. And the other thing that we're doing in this report is that we are tracking where the federal money that is coming to New York through the bipartisan infrastructure law, which was passed in 2021, that has money set aside for lead pipes. We're following the money as to where the projects are happening. And as I mentioned before, since most of the pipes are in Queens and in the Bronx, that's really where those monies are flowing for now. So it's a multifaceted operation in terms of this reporting. It's something we'll keep on top of, especially as we get closer to that 10-year period that I mentioned, and of course trying to get more funding for federal uses. So I'm gonna switch my slide deck in just a moment here. Because I have the CB6 information on a different deck. But in addition to this report, we put out this mapping tool, and this mapping tool here gives the ability to, at first, when you look at it, get a clear understanding by the different gradations of color there as to where the hotspots are within the city. And again, as I mentioned to you before, Queens and the Bronx have the highest concentrations, although you'll see there are little hotspots, in Brooklyn, northern part of Staten Island, West Village, etc. The mapping that we put together, and I'll send you the URL in the chat also, has a dashboard. Those numbers I showed you in the report, there's a dashboard on the bottom showing where the views are, what the numbers are there. And there's also an ability to filter to very specific areas. So by borough, by assembly district, congressional district, council district, Senate district, and neighborhood. This is an old slide because just last week, I added a new filter in there, which we're going to be launching next week, which has community districts. So another reason why I'm thrilled to be here is that this invitation really got us thinking, why don't we add another layer and add more information for constituencies to take a look at that. So let me stop sharing this screen and let me pull up the slides for you on what's going on in CB6. Bear with me for a second. Find my slides. Here we go. Okay. Terrific. So here's the situation. So we were able to filter this down to your community area here. So as I mentioned before, there's about a 14% known lead, 15% possible lead citywide. So for CB6, the numbers are a little lower. So it's about just south of 12%, just under the 14% for confirmed lead. And it's actually just about tied in terms of the citywide for the possible lead service lines. And so this is about average. This kind of meets the citywide average more or less. As you can see from the bottom there are 329 properties in the community board that have a confirmed lead pipe, and another 410 that are possible. They're unknown, and so that's something that will have to be discovered in the next few years by DEP to know what the situation is. So what I did was, and when I send you this map, you can put in addresses, and it's very dynamic. You can go down to a property level and find out what's going on there. I did take some screenshots just to kind of give you an idea of like where you might find clusters and what the mapping might look like. So typically, when you're looking at clusters or you're looking at properties, you'll see like little like thin slivers or medium-sized slivers, most typically. Where you would find a lead pipe, because remember they have to be in smaller homes. There are some larger properties that are older, maybe they're a little bit smaller, but usually you'll find typically slivers of pieces of properties. This is a property here, or a block I should say, on East 55th and East 54th between First and Second Avenue. Again, another sort of example of what you might see when you kind of zoom into the map, some larger properties here. And here's some other examples as you can kind of traipse through the neighborhood when you go through the mapping. So one of the other things that we found was that interestingly, there were some anomalies when it came down to the properties. We did find a number of larger buildings, like really large buildings, and we had to zoom in to see what was that. There are a good number of churches that fit the bill in terms of having a lead pipe. Because if you think about it, a church is a very large building, so much larger than a family home, but its water needs is not so great. So they may have one small pipe delivering all the water for the building. And we found St. Agnes Church as having a lead pipe, St. Illuminators having a pipe as well. Some parks, this little house I think here is probably where the water source might be for this particular park. I haven't visited there, but every now and then you'll see a park. I think Gramercy Park was another one that was in the district that popped up there. So, by spending some time, and again, I'll put this all in the chat and I'll email to you all afterwards. By spending some time and looking at the map, you all will hopefully get a better appreciation of what the situation is in your district. And I think that's the last slide that I had. So I'm gonna stop my screen. I've given you a lot of data, a lot of information. I will be sending you some more materials to take a look at after the fact. But while I'm here, I'm happy to go back to any slides or answer any questions that you might have at this time. Okay. Do I get to call on people? Marty, you had your hand up first.
Okay. What's the priority on fixing it?
That's the great question. So every single pipe in the city of New York, from the main to inside the building, is considered privately owned. Even the portion that runs in the street, it is considered privately owned. So DEP does not have a mandate or an ability to do anything unless it's told to do something about it. The projects that I mentioned before that are happening with federal money, DEP is doing those projects, and it's through an opt-in situation in those neighborhoods, but they don't have any authority. So you need an act of the local legislature to create a program, and so that's how lead pipes would get out. As I mentioned before, there's a 10-year window starting in 2027 through 2037, and we're eagerly talking to the city council about coming up with a program that would be equitable and efficient, and quite frankly, one that wouldn't cost any New Yorker any money, because our position as an organization is that, for over 100 years, about 103 years or so, at least, it was stated city policy to not just permit lead pipes, but at times encourage and at even times require it. Our position has been to, ask the city council to maybe come up with a program that would remove the pipes at no cost to all residents. And so we're in discussions with them about that, and they're trying to wrap their head around that. But the responsibility ultimately falls on the private property owner, except if the city were to come up with a program where it would take responsibility logistically and financially, provided that people give them permission and consent to do so. So that's the approach that we're taking with the city council, and we're trying to encourage them along with that.
Came up with a resolution saying that we want the pipes in CB6 to be, the lead pipes to be removed, replaced with the correct piping. Would it be best if we list the 400 properties, or if we could just indicate the number and say it's CB6 wants the pipes fixed?
So what I would do, I'm going to share my screen here.
Yeah.
I didn't want to, I wanted to save this just in case it came up here.
Yeah.
Oops. I shared the wrong screen with you. Pardon me for a second. I can send you information specifically, but the language that would make sense and it kind of gets at the heart of what I'm talking about here is that we're hoping that the city, pass a local law that would, require all lines to be removed consistent with federal law, and that it be basically a centralized program that would allow anyone that wanted their pipe to be replaced for free to participate in this city-run program. And again, having the city cover the costs and logistics is huge. The cost is obvious because to replace a pipe, it could be anywhere between $10,000 to $15,000. But the logistics is even more important because when you think about those clusters I showed you, absent a centralized organized program, you could have the same street ripped up 2, 3, 4, 15 times, 20 times, if it was left up to the private person to do so, the private owners to do that. And of course, if someone didn't want to do it and they wanted to, handle it themselves, they could always opt out. But to lead with that, to give, and this is an important distinction here, and I'm sorry, Kevin, if I don't mean to filibuster, I just want to answer Marty's question very thoroughly here. Another important aspect of this program is that we'd want to allow renters, occupants, co-op owners, condo owners, etc., to allow consent for this program to take place. Because right now, the only people that are getting notice about the presence of a lead pipe or not are the DEP customers, the people that get the bill. But there are many, many, many people who do not get the bill. And so first, they don't have any idea about this. And should the city come to, a program like this, we'd want to get as many properties to sign up as possible. So if for some reason you have an owner who refuses to answer or is an absentee landlord or whatever, there should be some allowance to give anyone who lives in that building who is drinking that water some level of consent to opt in to have this work done. And then the last thing is, we'd love to make sure that this work is done professionally by union labor, so that it's accountable. So we don't have any horror stories with contractors. But when I send you my slide deck, this will be in there. If you all were interested in some sort of a resolution or something like that, we can certainly have a deeper follow-up conversation about that, and I'd be delighted to talk to you about that.
Thank you.
Thank you. Kevin, you've been waiting so patiently.
Oh, thank you, Josh. This is tremendous, and the data that you have is so valuable. A couple questions. One is there recommendations on what to replace the lead with? I know it's usually copper, or iron, or plastic, but I know that there are now reports of plastic being an issue. Can you address that? And is that going to be part of your recommendations on what to replace it with?
Absolutely. Well, in the city of New York, we're fortunate in that the only material that can effectively be used is copper, and that's part of the commissioner's regulations. So other parts of the state, it depends upon where you're at. Our position is yes, copper would be the only appropriate replacement. You're absolutely right about PVC piping. There are a lot of more and more data coming out about how this might not be a very good choice. It's interesting, and the parallels are interesting. The reason why lead was used so widespread in 1850s, 1860s, and for so many years was that it was the cheapest metal that people could get their hand on, and economics drove it. And even though there's a lot of public health data saying that's not a good idea, economics drove the day, and we ended up having 100+ year legacy of lead, when if we listened to the public health folks early on, we could have perhaps made some different choices. Our fear and concern is that that might be another issue with plastic and people using PVC for that. And so that's our position. It's not as much of an issue in the state of New York as it is elsewhere, but we're clearly telling every community in the state of New York to replace it with copper, not to use plastic.
That's great. You use the phrase fear and concern. I live in Stuyvesant Town. There has been fear and concern that even though Stuyvesant Town, I guess, has replaced the piping, that it's some of the piping that actually comes from public property onto private property. In other words, pipes are connected to other pipes that might be under First Avenue, say. I don't know if this is true, but it is a concern here. Is that true that just because, let's say I'm in Stuyvesant Town and my drinking water there's no lead piping being used, couldn't that water doesn't just go through Stuytown? And the concern is, will all piping be looked at, even infrastructure underneath roads and boulevards?
Sure. So the thing about a lead pipe is that it is very small. It's 2 inches in diameter or less. So that's a very small pipe. So the water main is way bigger than that. So you're never going to get an instance where the pipes running up and down the street, the water mains are made of lead. So that's not a concern. It's when it leaves the water main to a building. And so if it's going to a really large building, a really small straw wouldn't do the trick. You need a much bigger pipe. So if the pipe is bigger than
But
2
when does
inches,
that leave? When does that cross over? It could cross before it hits the private property in this case. The water doesn't stop right at the edge, does it?
So when the water's coming down the main and it kind of kind of goes off in different directions from whatever service line is there, that's the point where it goes to becoming a private concern. Even though it's still technically in the middle of the street on public property, it's heading toward a building. And so the water coming out of the water main, there should really be no concern about the water main or the water source, really. It's when it leaves the main and it's headed toward the property. So Stuytown's a pretty big complex. So save for one like random building or one random, I've seen this before where like Stuytown, you have like these massive buildings. So really none of the buildings are being serviced by a lead pipe because you need a much larger pipe than 2 inches diameter. So sometimes there's a random small office or a random small place that is not connected to the water that's coming to the big buildings. It's just a separate line. And then sometimes we'll see that small property that's not attached to the larger property might have a service line. I've seen that with several condos and co-ops where they're enormous, and then there's a small like rental office or whatever, which is not attached to the main building. They have a separate line, and that ended up being a lead pipe because it was a really small pipe.
I have one last question, and
Yeah,
that's
sure.
schools. Has it been, I guess I can go into the map and look but have you done a drill down on schools that are of concern in CB6?
Yeah, so let me tell you about schools because that's my other specialty, as it turns out. So if you think about schools, they're really large buildings, and so the schools themselves don't have lead. They don't have lead service lines, but as I mentioned before, there's the plumbing issue, and so one of the things I first worked on in about 2017, 2018 was looking at what the situation was with the new state law that was passed in 2016. 2016, there was a state law passed basically creating for the first time a mandated testing and telling protocol, if you will, for school drinking water. And it was tied to the federal EPA levels at the time of 15 parts per billion. So since 2016, school water has been tested, and there's been a lot of improvements made. In 2021, there was an important improvement made to the law, lowering the level allowable in lead in school drinking water, and that's also taken effect. I can tell you in New York City, before the law was changed and after, has some of the lowest rates of lead exposure in the schools. There's something about the school infrastructure, believe it or not. I know we'd not believe this about city schools, but the operation and maintenance of the plumbing, the piping, etc. There is very, very little lead exposure relative to other parts of the state that we are finding. We are finding much higher levels on Long Island, much higher levels upstate New York and rural areas where perhaps the repair and maintenance, operation and maintenance has not been as robust as the city of New York. So proportionally, New York City has had, there have been some very dramatic exceedances to be sure, but in terms of the large scale, there's been a much lower rate of lead in school drinking water. I will be coming out with a report later this spring, just giving an update as to where things are at statewide, and that'll also kind of bear that New York City has a much lower level of lead in their school drinking water.
I'm sorry, Kevin, do you have any more questions?
At this time. Again, thank you, Josh.
Thank you.
Hi, Josh, I'm Rupal. Thank you so much for taking the time to come here and make the presentation. I have a couple of questions. Going back to what you mentioned earlier about the parks, some of the parks also have lead pipes. Do you know if the city has any plans to replace those pipes or fix it in the city parks that you mentioned?
Yes, they do. And I'm just sharing in the chat with folks here where you can get a copy of the report and the interactive mapping. The city now parks are interesting. I haven't studied parks as much, but I do know, and I can share this in the chat, that a few years ago, New York City Parks Department did a very thorough testing and mapping protocol called part of their lead-free NYC program, and they have done testing, they've done replacements, they've done mapping. I'm sharing that in the chat with you as well, and so that's what the Parks Department is doing. Funny thing about city agencies is that they don't necessarily coordinate and talk to each other. So I don't know if Parks knew about the pipe that DEP found, as I mentioned, in the one that was there, because Parks might have been looking specific at the water fountains, but DEP was also looking at any water source that could conceivably be used for drinking purposes, right? So it could be maybe that's going into a sink, and maybe Parks Department didn't think about that because they only were thinking about the bubbler, the water fountain. But there's another water source there. So hopefully there'll be a greater integration of data. For instance, when the Department of Health and Department of Buildings is investigating a lead poisoning case, we're hoping that now that the DEP has this information, that they will also take a look at to see if there happens to be a lead pipe delivering drinking water there. Because prior to this, they would DOH and DOHMH and HBD would just focus on the paint and all that, which is very important. It's the primary source of exposure, but they really weren't thinking about or asking about the lead pipe. Maybe they would order a test, but they wouldn't really know about the pipe material. Now that we have this material, again, we're hoping that city agencies this data, that city agencies will work together to kind of, cross-pollinate and kind of be smarter about how they're looking at things in the totality.
Another question. So you said there were about 15%, give or take, where it's unknown.
Correct.
What are some of the steps that, let's say, somebody who's living there, whether it's a renter or a property owner, can take to figure out one way or the other, whether it's lead or not? Like, how do you go from unknown to a known? What are the steps they can take?
So the only way, so a renter or a tenant really couldn't do it. It's someone authorized who'd have to, be able to go in the basement and see where the pipe literally enters the building to do a visual or magnetic test. And that's how that property would know. DEP is doing some statistical modeling and some analysis to kind of figure that out as well. At some point, per the federal law, they're going to have to make sure they know 100% of what's going on in their inventory. So it might be a combination of DEP doing some investigations with permission from property owners, or asking property owners to do some investigation. But there's really nothing that an individual who rents or is a tenant, co-op or kind of can do, because you have to have access to the basement, and so that would really preclude most people. If you own your own home and you own your own home, congratulations, and you have access to the building basement, an individual private homeowner can do that for themselves.
And one last question, the water testing kit, I actually ordered one. I
Cool.
got it just before I went on vacation, so I haven't yet used it to send out the sample. But is it only gonna test for lead, or is it gonna test for other maybe hazardous chemicals or anything else as well? Or is it simply gonna be lead or no lead?
It's just lead, and what will happen is you'll be instructed, and everyone should do this. It's really, really cool to do. You'll get a brown box, and there'll be two bottles in there, and you'll get instructions to have your water stagnate, just don't use it for a period of 8 to 10 hours, etc. And what you'll do is you'll put that bottle underneath, and you'll turn on your tap, and that'll be your first draw, the first liter that comes out, and you'll put that aside, and you'll let your water run for probably I don't know, I can't remember, it's like a minute or two, and then you take that second sample, and then you take both things and you bottle it up and you send it away. And so the reason why you're taking the first and the second sample is that very first one will give you an indication as to whether or not you have a problem with the indoor plumbing, because that's the water that's closest to the sink, that's really would be a concern of your indoor plumbing. And the reason why you take that second sample of waiting several minutes is to see if there's an issue outside of your building, that service line. And so you'll get the results on both, and you'll get an indication as to whether either or both or neither are above the allowable level as set by federal law.
Thank you very much. Thank you for the presentation and answering all these questions.
You're very welcome. Any other questions?
Yes, well, Joshua, so how do you think CB6 can support to reduce the use of lead pipes?
Well, two ways. One way would be, and I'm happy to meet with members offline on this. One way would be to help amplify the message that has already gone out to people in the community about the presence of a lead or a possible lead pipe. As I mentioned before, I think there was like 700 or 800. There were 700 or 800 properties, possible lead. It's like 300 or 400. They all got all the owners, all the customers got a letter saying, you have a lead pipe, or you might have a lead pipe. This is what you should do, et cetera, et cetera. They only went to the owners or the customers. All the tenants, all the people who don't get the bill didn't get that letter. And I don't know to what degree that the person who got that letter, if they shared that information or didn't share that information. So there's a knowledge gap. So if there's any interest in helping to amplify district-wide about the presence of a possible presence of lead pipes, we're trying to get the word out to people, because as I mentioned before, and I'll say it again, it's super easy to prevent lead poisoning from water. Just make sure you flush that water first thing in the morning or after a long period of non-use during the day. And we want to be able to prevent people. The second way is we could use support by letting your local council member know that you would love to see the city introduce a bill that would create a citywide program that would allow property owners to opt in to have their pipe replaced at no cost. And that's something I would be happy to discuss with you all as well. We're trying to build awareness of this issue. It's not getting enough notice, and it's a big deal. And the best part about all of this is it's a problem that we can actually solve with our time here. So Again, happy to follow up with you all on either or both of those issues if you're willing to have a dialogue about that.
Thank you.
Just,
Brenda?
with regard to the spray and awareness to tenants that, like they may or that they do or might have lead pipes in their building. I'm happy to, like get some information on messaging from you all that might be used in our newsletters.
Okay.
We have like a weekly e-blast and a monthly
Yes.
e-newsletter. That's a way of our spreading the word to our constituents, many of whom are tenants. So.
Absolutely. And I would encourage them, listen, the Department of Environmental Protection, I mean, my map is lovely and colorful, but it's really more for like public policy stuff. The Department of Environmental Protection has a much easier to use map, and they have all this information handy as well, where people can go up and literally just look up their address and find out the situation in their building and do that. So yeah, happy to connect you with the verbiage, but it's really going to probably be mostly passing you off to probably the best parts of the New York City DEP sites, which I think is a great thing because they're a very good resource and a very good partner.
That's good. We'll be in touch.
Yeah.
Terrific.
Thank you. Thank you so much, Joshua.
Well, great. Thank you very much. I wasn't monitoring the chat, but I don't know if I answered. Francisco had a lot of questions, so I don't know if I answered them. I will quickly scan them, but I think I touched upon a lot of these issues. Okay,
Yes.
great.
Thank you. Again, thank you so much for coming.
Well, thank you. I look forward to following up with you and have a good rest of your evening and a good meeting tonight.
Yeah, you too. All right, so the second topic in our agenda is a discussion of a resolution on increased reimbursement rates for Medicaid patients at Bellevue Hospital. And Karen is here. Karen?
No. Good evening and thank you. I appreciate the opportunity to bring this matter to the board, to the committee. My name is Karen Moore. I'm the co-chair of the Legislative Committee for Bellevue CAB. Prior to this, I was a member of the CP6 for 8 years, so Evie and I served on the same committee together for a bit, serving on the Health and Budget Committee and the co-chair of the Mount Sinai Beth Israel CAB from 2018 to 2025. Previously, I saw Bellevue as the public hospital at the end of 27th Street and 5th Avenue, but First Avenue. But personally, I was a patient at NYU. My introduction to Bellevue came about when my husband was hit with a cab and transported to Bellevue with multiple fractures. I spent 7 hours in his ER bay watching the streams of patients moving about, coming in and out, and then 1 week visiting him daily and asking the staff constantly for updates. Everyone responded very professionally, and this experience has given me a new perspective on Bellevue. I was impressed by his care, and I joined the CAB to raise awareness that Bellevue is a modern hospital, and as such, it's the tertiary care jewel of Health and Hospitals Corporation and deserving of support. So that's my personal Bellevue story. Bellevue is the oldest public hospital in the States. It's not just an institution, it's the cornerstone of healthcare equity, as we know. We are familiar with the story of Bellevue starting as an almshouse in the 1700s, and for centuries it stood as a symbol of our collective commitment to care for everyone, regardless of income, insurance, or immigration status. As a safety net hospital, Bellevue has always been a place where all comers are welcome and the doors are always open. That's actually a pretty radical idea. Despite this sort of all comers open door, Bellevue has a distinguished history of contributions to public health, medical education, and innovation. It delivers cutting-edge treatments and procedures like cardiac catheterization and ESMO, services that in private hospitals and when reimbursed by commercial payers, generate the margins needed to subsidize lower margin services such as behavioral health and emergency care, Bellevue's two most storied specialties. So as you know, hospitals make money through reimbursements from patients' insurers. However, as a safety net hospital, Bellevue operates under fundamentally different financial pressures. Unlike private hospitals, which rely on a favorable payer mix skewed towards higher payer commercial insurers, Bellevue's mission as a safety net hospital makes it uniquely dependent on city, state, and federal funding to bridge the gap. 60% of Bellevue's patients rely on Medicaid for their health insurance. Unfortunately, Medicaid only reimburses 70% of the actual cost of care. So to provide some context on what this means for Bellevue, in 2021, if Medicaid had reimbursed all costs, Bellevue Hospital would have collected an additional $863 million, which is the most of any hospital in New York State. And New York City Health and Hospitals collectively, as a public hospital, would have gained $4.3 billion. However, even with its resilience and efficiency, Bellevue is facing mounting challenges, as we know. There are two. One is the larger political environment, when it's not sure what will happen to social programs in the era of government efficiency. And the other sort of challenge is much closer to home, as we know. With the impending closure of Beth Israel, Bellevue is bracing and has already been receiving a huge influx of patients, particularly in emergency room and behavioral health care, the two of the lower margin specialties. In fact, Bellevue's census has been over 100% for a few months. So that means that if there are 830 beds in Bellevue Hospital, there are 863 or 64 people who need a bed. So it's a pretty sophisticated modern hospital. So they are working hard and innovatively to try to absorb this influx. But given the funding constraints, we at the Bellevue CAB want to remind everybody that Bellevue needs our help. So a solution is an increase in Medicaid reimbursement rates. It'll help Bellevue. Actually, it'll help every hospital in the state. It will help all the New York City Health and Hospitals. And we're asking for your support on this ongoing need for increased Medicaid reimbursement. And from our perspective on the board, but it may not be yours, this is not just a matter of financial necessity, it's a moral imperative. Raising Medicaid reimbursement rates will allow Bellevue to continue maintaining providing its world-class care to everyone who walks in, stumbles in, or is brought through the doors, while maintaining its vital role as a flagship for the New York City hospitals. Raising reimbursement rates will ensure that Bellevue can expand its critical service lines, invest in infrastructure, and meet the growing needs of our city without compromising its historic mission of providing care for all. So the Bellevue CAB is asking for your support in fulfilling that promise and securing Bellevue's future. And I want to say thank you to the committee, and also I want to thank Brian Federo, colleague of mine on the board, who feels very passionately in some of these rules ideas. Any questions?
So Kevin, the resolution.
Yes, there is a draft of a resolution that I did share with Elvie. The question is, we do not have quorum. Is that what I heard at the top?
Yeah, we don't have a quorum
That's
tonight.
correct.
Okay, so it's I do see that CB6 chair is here, and is this something that potentially can go to executive if we feel it's time sensitive? But I would like, and I also want to give a shout out, because I know Shays Robinson from Bellevue is on board. And I wanted to address if there's any timely issues to a resolution. In your mind, Karen, and also Sage, if she wants to weigh in.
Okay, so from the care perspective, and Sage may give you the hospital perspective, we are our lobby day, our annual lobby day is February 24th. That's the date of our February meeting. I believe it's also the date of regardless. So we are doing two things. Number one, we are looking for resolutions, and number two, we have started a petition asking for support for Bellevue. And so we would like to present this resolution at the February, to the electeds at the February 24th meeting. So that's our timing.
So, Sandy. Sandy,
Sorry, yes, I am here. And we could, actually Brendan, let me know that this was an issue. So we could either have this at exec, which is next Wednesday, but unfortunately it would mean another presentation. I'm sure there'll be some questions if it's at exec.
Of
Or we-
course.
Yes, we could ask the Budget and Governmental Affairs Committee to take this up. And Brendan, when is their meeting?
So their meeting is on Monday, February 10th. That is 2 nights before full board, which is on February 12th.
And, you know, with timing being what it is, that's probably adequate. Excuse me. I'm wondering if they may have some additional questions. It's a state issue, is it? This is something that would be done at the state level? They're changing the percentage for Medicaid?
Yes, and it's a perennial request of the Health and Hospitals Association and their lobbyists in Albany. We are trying to generate local support to show that it matters.
Mhm.
I believe that the city council, it's also Health and Hospitals Corporation is a city agency. However, yes, we are looking towards the state for reimbursement.
Marty,
Since this was on the agenda for about a month now, why wasn't this resolution sent to the committee? We probably would have gotten a quorum.
It was sent to the committee, Marty.
I didn't get it.
I believe I'm not sure it's a month. Is it a month?
no, I actually just got it.
Yeah, it's pretty recent. I'm not really
Okay.
sure when internally, but I raised it pretty recently.
It was a recent development, correct? Within the last week.
Yes.
I got it and the rest of the committee did not. Is that what happened?
No, I got it too.
No, I have it too. I remember getting that email.
Okay.
Yes, we sent it on, the office sent it on Monday. So I don't know, if the email might have landed in your spam, or, I know that can happen to me on occasion.
And
But-
the office was closed over the holidays, so, you know, to be fair. I'm thinking that it might, excuse me, give us a little more time to confer, you know, to approach our elected officials and let them know that we're going to be discussing it and get some of their feedback and see if they are also supporting this issue. But it could be either case, but I think unfortunately, you would need to come back and do another presentation.
That's not an issue.
Okay. Do we have a sense I mean, it's either next Wednesday or February, was it the 8th, Brendan?
Just a moment, it is Monday, February 10th.
February 10th. I mean, exec is, I believe it's 17 people, so it's a really good idea of how the board sees the issue. if it passes that exec, it's a very good endorsement. But again, I do leave it up to the committee and to you. Either date would be fine.
You all can tell me.
Yeah, we can probably present in the executive meeting next week.
Okay. We'll plan on that and adding it to that agenda. It's the meeting starts at 6:30. First,
Yep, it's here. And the office can send invites to you and to Sage.
Okay.
For that meeting.
Yeah.
Actually, I have just a quick question. So this is specifically for the state budget? Just checking because I see
State and city.
so it's state and city budget.
Yeah.
Okay.
Medicaid is state, as Sage will say.
Yeah.
We are, and almost last year and the year before, they made small adjustments. So we're just trying to keep up that pressure for that happening.
and
I'm sorry, I'm gonna jump in. Hi, it's Sage. Thank you so much for having us tonight. We are waiting on the state budget, which comes out in the middle of January. So it's not just to give you a timeline of when we would be looking for. Karen's correct. Like, it would be nice to have the resolution done by the 22nd of February, but as it is a state administered program, it's tied to the state budget, which does not come, I believe it's January 15 or January 21st, I believe it is. So thank you.
And I'm sorry if I missed this information, but if they're only, excuse me, 70% is paid through the Medicaid, who pays the rest?
City, the state, various other programs that, various other programs for money, and then it started, its original intent was no longer relevant, so they started cutting that. There was a designated, actually, what's it called? There was also something that, a designated safety hospital or a designated hospital. Once the Affordable Care Act came out, they started cutting that funding on the assumption that everybody, disproportionate share hospital, meaning, you have a lot of people who need Medicaid. Once the ACA came out, they started cutting the disproportionate share program on the assumption that everyone would go on to the ACA. That hasn't really happened, but so actually funding for healthcare is incredibly complex. And what we're trying to do is just keep awareness that the Medicaid reimbursement rate is insufficient to provide care, and we're looking for the state to be reminded that the reimbursement rates are low. So we don't anticipate that anything we do is going to make a fundamental effect this year. Medicaid is such an issue that all you can look for with Medicaid is incremental improvements in the rate, because there are so many people who need health insurance that it's a very expensive program. So we're looking for an incremental improvement in the rate. We're not looking for parity. We're not looking for, and we're trying to just keep the legislature aware that Bellevue is this really great modern hospital and it needs to be supported.
And, I mean, certainly we hear about MSBI closing and how that is going to be a huge effect on, our community. So yes, I think even when you present at exec, if you could really stress those two issues, I think that's very important for people to understand. So. Okay, so, next
you.
Wednesday. Sorry you have to come back, but.
So,
Yeah.
I'm in the neighborhood.
Yeah.
You-
Kevin?
Yes, this is going to be quick, since we do have this working draft of a reso. It says in there now Bellevue Hospital. I just wanted to say that stylistically, it really should be NYC Health and Hospitals / Bellevue. And I just want to make sure that that's a thread that's through anything we do about Bellevue to differentiate. That is their formal name.
Yeah.
Like that?
Yeah, make that global
Yeah.
dark, but that's all.
So like it is
Yes.
right now? Okay.
Yep.
I'll,
It's an HHC hospital or health and hospital.
yeah, I'll work on making universal offline.
Yeah.
Thank you.
Karen, thank you
Thank
so much and
Yep.
see you next
Yep.
Wednesday.
Bye.
Okay, so I don't have anything to report today. If any member of the committee has any old or new business, please raise your hand. If there's no objection, we will adjourn the meeting. Seeing no further business, the meeting is adjourned at 7:43. And thank